Hello, I'm Morris Kochanski, Wilderness Living Skills and Survival Instructor. The topic this time around is on first aid and bush medicine. Now, the situation is that anybody that's going well off the beaten path, I would say it's quite important that you have some medical knowledge that is tied in with what you're up to. If you're going to use an axe a great deal, then maybe knowing how to put together a kit that would deal with a good axe cut and so on. But in general, you're your own doctor, and so you have to know a certain type of first aid that maybe relates to being in an isolated off the beaten path situation. One of the books that I came in contact with many years ago is the Mountaineers. I think they're people that are sort of in the area of the mountains found on the western coast of America, Washington, and so on. And the Mountaineers came out with a book that was a kind of a cut above the normal of what you would normally what you would find in general first aid texts. You had to practice some skills beyond the normal first aid taught at the time. And the one story was that these people brought an injured mountaineer who'd fallen off a mountain into the hospital, and the doctors began to look at this person and said, "Boy, you're lucky that the truck hit this guy in front of the hospital." Well, he had fallen off a mountain 80 miles away, and the medical knowledge that the Mountaineers were currently trying to instill in the Mountaineers of the time was of such a quality that they knew how to handle such an injury so well. But at any rate, this is almost a classic. You'll never come to any harm reading this book and absorbing the information that it provides you for the off the beaten path. Where There Is No Doctor, a Village Health Care Handbook. The title speaks for itself, that traveling in isolated situations or certain knowledge that you might want to have above dealing with a cut or a burn or whatever. Take care of yourself. This is the Consumer's Guide people. They come up with very well worked out conditions. This is a little bit more than just first aid, but it's something that a person who has a family, when you have a lot of kids in your family, you should perhaps know more about many of the things that when you get a larger group of people together, what they all can come down with. Another classic, Death by Exposure by William Forgey. I've actually talked on the telephone with this fellow on one occasion. This whole book devotes itself to the phenomenon of hypothermia. Not just a few pages as in many books, but a whole book on the one subject, so that the person who spends a lot of time in a cold environment might need to do more than just warm a person up beside a stove. Another specialized type of isolated situation is the Seafaring People, and here's a manual that is very different from most manuals, and it's what they suggest that a ship's captain should know about the type of emergencies that may occur, and what to do about those emergencies which normally should have been handled by a doctor. There is a very large $350 book that I think you can get on the internet or whatever. But this is the field book version, edited by Averbach. So from a 10-pound book to one that maybe weighs 1.5 pounds, a concentration of modern medical knowledge, very current in its knowledge about any type of subject, from what to do about insect bites to the most current knowledge on how to deal with hypothermics and so on. Here is one that's specifically written for the out of doors. It's Outdoor Emergency Medicine by by one doctor anyway, I can tell. He's editor. The book strikes me as being handy to know in the consolidation of the common everyday outdoor first aid as opposed to general first aid that you usually might be applying around the home. Well, the overlap on the books that I have chosen is actually very small, you might say. That each book presents its subject in such a way that you find that the information adds up rather than getting it over and over again. In going through these manuals that were chosen carefully so that they all had a lot to offer without too much duplication.